Another way that I use YouTube is through the educational videos that are out there. Lots of great educational videos out there on multiple topics related to community health. And again, you guys could create your own educational videos to put out there for your staff, for those of you who are in public health, for your students, for other health departments, for the public, for anyone that you think would benefit from viewing your video. And what I think is great about this is this could really be kind of the next generation of guest lecturers. I find a really hard time getting public health nurses to come into my classroom to be guest lecturers because you guys are so busy and you do so much, and especially now with the H1N1 going on, you guys have no time to come to my classroom. But if you could sit down, be interviewed for 10 minutes, put this video together, the students could do it for you if you get a partner in academic practice, and then you can share that with all the schools in your area and all around the world even to showcase your expertise and your programs that you're doing in public health and really get the word out about what you guys really do in public health. And then I do have a quick example of one of those. So this is one that, I'm not going to show the whole thing, just a minute of it so you can kind of see. This is actually put out by the CDC. So again, very reputable sources that are putting a lot of these together. And it's their update on childhood immunizations. So, it's really hard to find a very updated childhood immunization video to show to people. So this is kind of really a neat little video. Again, I'm not going to show the whole thing because you can kind of see it goes over the history, what the current recommendations are, how to actually administer them. So it's a really, really great tool. I don't know how to get that back to the, there we go. Okay. And then another way that I use them, and you could do this in meetings with your faculty if you're in practice, or with students, is I use formal and informal case studies, and one of which I use a video on assessing health risks among families, and this, I think we're running short on time, so we're not going to show, but if you get a chance, this would be one I'd really have you guys watch. It's a documentary about childhood obesity, and it has a very, very overweight child, and they're interviewed in the home, so we get to look at some of the home environments that they just viewed in the video. And we talk afterwards about what are some of the risk factors that you saw. The mom is obese. They talk about what they eat. The child's exercise is a little basketball hoop on the porch, so he's exercising, but not really moving much because the mom thinks she's doing everything she can, but she's really not. So it's a great clip, and I really encourage you to watch that. Another way you could use YouTube is through expert interviews. I found a lot of great ones out there. One of my favorites is an interview with a public health nurse who works in TB case management, which is a very unique program in public health. Hard to find a guest lecturer to come in and talk about that. But I play this, and it's a just one-on-one sit-down interview with a man who works in TB management, and they ask all about what they do in the regular day, how they like their job, what some of the roles and responsibilities are. And I know Lisa Atchison and I have talked that this would be a great tool to use in the health department, because a lot of times in orientation you want new people to meet all the different departments and people who do different roles throughout the health department, and it's hard to find that time. But if you sat down with everyone once, did this video, you could just have them watch the YouTube videos of each person to learn about the different roles and programs in your department. So you guys can use this stuff in practice, it's great. And then just some words of caution, just like with any internet-based media, you really need to evaluate your source, because there is a lot of junk out there. You guys have probably watched a lot of it, very funny stuff. But there's also people who present themselves as experts and aren't really giving expert advice. So just with anything that you utilize, make sure you evaluate the source of that information. And then if you are posting your own videos, like I am going to be posting this presentation today, you need to make sure that you get consent from the people involved. Although even though the backs of your heads will probably be the only thing that make it in here, I had you guys all fill it out just to kind of show you how simple that consent form can be. And if any of you did want to come up and introduce yourself and ask a question, then I would have that consent, so I can post this on YouTube. But I will send you guys all the link to this presentation today so you can share it with others. And then one thing that I found that sometimes the videos aren't there the next time you go look for them, because if the host decides to pull that video off, or if that host gets kicked off YouTube for something, that video may not be there. And I've only had that happen with one video out of probably 100 that I've used in the last couple of years, but it can happen, so just be warned that you shouldn't, if it's not your own video, it might not always exist there based on that link. So you might have to research for it, or it might just not be there at all. And then if you want specific information on how to create a video, upload a video, what the requirements are for YouTube, they do have a great handbook that's very user-friendly on YouTube. That's the link for it. It'll tell you all about what the file sizes are that you can use, copyright issues, how long it should be, things like that. And some great hints on like video recording and all of that, and lighting and things like that. So, and then I was asked to talk about how this presentation relates to the health and system priorities of Healthiest Wisconsin 2010. And using YouTube doesn't directly relate to any single one, I don't think, but I have found videos that highlight almost all of the health priorities and system priorities, so they're pretty much all listed here. And I found videos for every topic in my class. That's usually how I introduce lectures. I usually do 3 to 4 different issues or chapters per class, because I only teach 1 day a week. So it kind of breaks up my lecture. I show a quick YouTube video about what we're going to be talking about, and then we transition into the lecture. So it's kind of a neat little way to talk about the different issues. So there's some more of the health priorities and then the system priorities. And then last but not least, because I'm in academia, I wanted you guys to hear from someone in practice who actually uses YouTube. So I'd like you to welcome my co-presenter, Lisa Atchison, from the City of Milwaukee Health Department. She's going to share with you how she uses YouTube in practice.
Yes, good morning. Lisa Atchison. I'm the Director of Nursing for the City of Milwaukee Health Department. And I just wanted to share some personal experience and how this is helping. April 26th, swine flu hit. I had 55 public health nurses out of 4 different buildings. Yes, we all did NP swabs when we were in nursing school, but all of a sudden, because of the surveillance issues and the media was, asking questions, I needed to get 55 nurses trained or retrained on correct technique, safe practice for nasopharyngeal swabs. Went, did a search, found a fabulous 3-minute video. It was actually taken in a nursing school. A student group had done it, talked about technique. It was fabulous. And because my nurses, again, 4 different buildings, to read the policy is one thing, to have the test swab kit with you, but actually to see it happen really helped us very quickly, very efficiently get out in the field, out in the community to do some of the swabbing techniques.
Great. So just in summary, I hope that this presentation, though very brief, showed you that YouTube really can be a very affordable, effective, and kind of a very fun way, in many cases, to do a lot of things. It can engage students in community health, get them excited about different topics, really understand what it's all about, provide orientation and resources to your public health workers, and then also to share your programs and expertise with others, and especially with the community, because that's what we're all about, is promoting